The job is simple but critical. Use millions of tax dollars to drive the state sick and poor to the doctor. But what is the best way to get that done? That's what the state is trying to figure out right now. Becky Oliver in studio just got back from 2 days of public hearings on this subject. Becky.
Well, this week the state got an earful from Metroplex parents, drivers, and social workers who deal with the Texas Medical Transportation Program. And while some support the current system, others say that it is broken and in need of repair.
We have a real problem. We have a real problem.
The problem, some believe, is the state's new medical transportation system. Some testified it isn't working.
It's just very, very upsetting to me to hear that children are being denied rides this program. It's just that veterans and our older people do not need to have this happen to them.
In April, the state contracted with a Georgia-based company called Logisticare to get the state sick and poor to the doctor. It's a roughly $30 million contract. It's called a full risk broker system, and payments are based on the number of people who are eligible for rides, not the actual rides. In the first 5.5 months of the program, there were almost 6,000 complaints, from no-show drivers to late appointments, even injuries, representing a 1.2% complaint rate. In Fort Worth, Jeff Heckler told the state the concept just doesn't work.
This system is created to avoid giving service. It's a capitated system. So the more they can deny rides, the more they can put you on hold for endless amount of hours, the more they can leave you hanging out at a curb somewhere. You're not going to use the system, they get paid more. And that's the deal.
This mother told the state she just gave up using the program. It was too much for her handicapped kids.
It was such a strain trying to get someone to, help you. And as many of them talked about, you're on the phone hours. Those are real issues.
I particularly work with 200 transplant families, and it has been a very rough period the last 6 months dealing with this full risk broker.
This man came to the defense of Logisticare. He works as a subcontractor, driving people to their appointments.
I was driving a wheelchair van. Okay, nobody told me how to tie a wheelchair before. I was doing this for 8 years. When Logisticare came, number one, they give me the opportunity to get somebody to train me how to do it.
Logisticare has the contract in 13 North Texas counties. The state is taking public comments in 10 Texas cities.
Please put our sick Texans, children, and our elderly back in the hands of Texans, because no one cares about us the way we do.
Becky Oliver back in studio now. All right, Logisticare, that's the company that was really at the heart of these hearings that were for 2 days. Was Logisticare there?
Logisticare, a rep was there at the meeting, and I followed him out of the meeting and declined comments, saying that it's corporate policy not to talk to the media.
Corporate policy.
Corporate policy.
$30 million contract, not feeling responsible to talk to the media and the public. Okay, let me ask you, could you get them to specifically talk about a couple of those cases you've talked about, the blind passenger, the wheelchair passenger, any of that? You get any movement on those?
Here's basically how it works. Logisticare says we respond to the state, but we cannot comment on individual patient complaints because of privacy laws. They emphasize over and over again, we have a 1.2% complaint rate, but again, Logisticare is taking those complaints that are being passed over to the state. So it's Logisticare taking the complaints.
I don't want to say filter, but any complaints they report, they'd have to self-report. They're taking the calls.
Absolutely. And
so if somebody complains about me, am I likely to tell you about this? That's what they would be required to do, and that's, who knows.
It's one of the reasons that Senator Nelson, in our story on Monday, said this is the fox guarding the hen house, and that's why she's raising those kinds of concerns in the legislature.
Okay, Becky Oliver, we'll see where it goes. Thank you.